Hello, today I'm going to discuss basic catheters on pictures and how they can be used for urinary output measurement. So first, let's discuss what are the types of catheters and how they look like. So there are three types of catheters: indwelling catheter, external catheter, and short-term intermittent catheters. They can be made out of rubber, plastic, silicone, or other materials. External catheters are catheters such as the condom catheter, and short-term catheters can be such as Robinson catheter and infant feeding tube, which is used in the case of pediatric patients. And here you can see how those catheters look like. There's the indwelling catheter, the intermittent or short-term catheter, and the external catheter. So now I'm going to be talking about urinary output measurement. If the patient has a urinary catheter in place, then urinary output can be measured by observation of the measurement markings on the collection device. Some catheters have a single bag which all urine drains into immediately, whereas others have a separate chamber that urine drains into first. The first chamber can then be emptied by opening the valve, allowing the urine to move into the larger catheter bag. Catheters with a separate measurement chamber can make it easier to assess a patient's rate of urine output. Now let's talk about how to measure the patient's urine output. First of all, we need to note the time at which the patient's catheter bag or chamber was last emptied. Then we need to inspect the catheter bag or chamber at eye level and note the volume of urine present, which is typically in millimeters. Then we need to record the volume of urine on the relevant urine output chart and the time of the measurement. Lastly, if the catheter bag is full, this should be emptied after your recording. If the patient has a separate urine collection chamber device, the valve should be open to allow the chamber to empty into the catheter bag, and the valve should then be closed.